speakers for them. Oh, you mean these? Oh, I don't know if that's a speaker or a microphone. Y'all are fine. We're good? Okay. Thank you, ladies, for coming and joining us. I'm sorry we had to change this from last week to this week and right in the middle of Olympics, of course, but we do appreciate you guys coming. It is going to be on YouTube, so you can encourage others to watch it on YouTube, and we will probably do it again in the near future. That way, the ones that weren't able to make it today are able to make it at the next one, and we'll try to get it where it's not during any other activities. So we're going to talk about, first let me introduce my team. So I had the whole therapy team come for this so that you guys could kind of see what each discipline does differently in relation to falls. So Cheyenne is our OT, Shannon is PTA, that's with physical therapy, Diane is occupational therapy assistant, Alexis is our speech therapist, and then I'm Amanda. I'm a physical therapist assistant, and I am the rehab manager here. So we're going to talk a little about fall risk and prevention. A few fall myths. Falling happens to other people, not me. Anybody ever heard that one? Myth 2, falling is normal as you get older. Myth 3, muscle strength and flexibility can't be regained. We definitely know that's a myth. Myth 4, using a walker or a cane will make me more dependent. That's a big one here that we see quite frequently. And myth 5, I don't need to talk to family members or my health provider if I'm concerned with falling. I don't want to alarm them, and I want to keep my independence. Okay, these are just some fun facts about falls. So falls are not inevitable in aging and can be substantially reduced with fall prevention programs. Falls are the leading cause of injury in adults 65 and older. In 65-year-olds and above, falls are the leading cause of injury related to death and the 7th leading cause of all deaths. In 2021, there were more than 38,000 deaths related to falls in those 65 or older. Falls oftentimes are multifactorial. The most consistent predictor of falling is a previous fall. You guys have probably heard that from us in previous in-services on falls. Up to 60% of adults do not recover to previous level of mobility post-fall. That's kind of a scary one. Women experience about 70% of hip fractures treated in the emergency department. So of all of the falls and all the people that end up going to the ER, women are about 70% of those with hip fractures. Muscle weakness is a major predictor of falls. There we go. So reasons falls occur. Changes in eyesight or hearing. Eyesight or hearing. The eyesight is a big one in this one, and what we notice is that as people age, their eyesight tends to deteriorate, and then they start having difficulty guessing, like their depth perception is off. So a line in the floor might look like a step to them. So you can see where that might cause somebody to fall, thinking that they're stepping, and there's really no step there. Changes in reflexes, of course, that's how we respond when we lose our balance and how quickly we respond. Medical conditions like hypertension, diabetes, heart disease, and Parkinson's. Cognitive impairment, sarcopenia, which is just age-related muscle loss. Poor balance, poor strength, medications, unsafe footwear, safety hazards around homes, pain, being distracted, and unfamiliar environments. So these are some common things that you may notice that could lead to increased risk of falls. Some things that we see a lot of times when people come to us in therapy, they'll tell us, I'm having difficulty with, and these are some of those things. Increased difficulty getting up from a chair. That could be a chair, a couch, just a common surface you would sit on that you've never had difficulty getting up from, but all of a sudden you notice this is getting hard. Feeling weak or lack of energy, unsteady gait or worsening of balance, and that's typically something that you notice fairly early on. Increased difficulty stepping up into a shower. That's big here because we have the showers that have the little lip on them. Sometimes people get fearful of those, and that's another one with eyesight that could, as your eyesight starts to deteriorate, that could be a big issue for you. Difficulty going up and down stairs. Now this, of course, isn't as big of a risk in Scotia because you guys don't have to go up and down stairs, but in the community, when you go to the doctors and things like that, or you go to a family member's home, you might have to go up and down steps. So some dangers of falling. Strains and sprains, increased risk of injury, hospitalization, and death, difficulty or inability to move around independently, medical conditions and health problems related to prolonged immobility, neck injuries, head injury, pain or discomfort, fractures, and I put up there especially hip and arm/wrist, and we'll talk a little more about that, and then heightened risk of fear of falling again. So these are what we would say in therapy are the most common fractures that we see from falls. I personally would say that hip is probably number one on that list. And then wrist, your shoulder, and pelvis. These are a few other injuries that happen, head injuries, concussion, internal bleeding, hematoma. These we know and have seen that can even cause death. I mean, we've had people that have had falls that live less than 24 to 48 hours, and usually that's because they've got bleeding on the brain. Bruises and lacerations. We've all seen that around here when we get new folks in, especially on skilled side. I know some of you come down there and visit, so you see the ladies or the gentlemen with the bruises across their face or bruises on their arms. And then strains and sprains. So strain, of course, is muscle. It's where you have tears in your muscle fibers, whereas a sprain is ligament. So what happens is you stretch out those ligaments, those tendons, and then it makes those lax. It makes you more susceptible to injury, and it doesn't give your joints the stability it needs. So this is kind of a little never-ending cycle that we see a lot with falls. So you have a fall that occurs. That induces fear of falling again, which we know is a real fear because we know from the facts that once you fall once, it doubles your risk of falling again. So rightfully so, being fearful. That causes people to become complacent. They get fearful. They don't want to do the things that they were doing. Then you start to see medical condition deteriorate, and then strength decreases, your mobility decreases, and then you're at even higher risk of falling because now you're not moving. When you do get up and move, your strength is not there, which puts you at higher risk of falling. So these are just a few tips, and it's funny to say this because usually when somebody falls, it happens suddenly, so you don't think to do these things. But these are some tips that if you have time to react, might be useful to try and do. So don't tense up and stiffen your muscles. The reason we usually see wrist and arm fractures are because people tend to try to stop their fall. So they throw those arms out to try to keep themselves from getting hurt, and then they break one or both wrists. Protect your head. Turn your face sideways, tuck your chin, bring your arms to head level if you have time, if that's the direction you're going, especially. Try and stay in a bent or curl position with knees and hips bent and fall towards the side. Spread the force of the fall. So if you're able, you want to go to aim to the more fleshy parts of the body, your back, your side, somewhere where you got a little more fleshy part of your body, a little more flesh on your body. That way you have a little more padding to break the fall. Now, some of you have seen this if you've been with us in therapy, but I'm going to have Shannon kind of demonstrate this. This is like our steps to getting up from a fall once you've had a fall. Mm-hmm. Yeah, so I'll go through them, like each of them, and if you want to just do. So, of course, the first one is going to be, you're going to prepare yourself. Yeah, that's fine. Yeah, that's fine. She has fallen out. So getting up quickly or the wrong way may cause worse injury. So the first thing you want to do anytime you fall is stay in that position for a minute. Are you hurting? Do you feel like anything is injured? If so, you don't move yourself because you could cause worse injury from that. Hopefully you guys all have your buttons here, so you could always push your button. If you have a cell phone, you could call somebody to come and help you. Call 911 if you are hurt. If not, you can proceed through these steps. So you're going to find a sturdy piece of furniture or a staircase. And of course, for most of us, we would have to crawl to that because we might not be right beside of our chair or beside of our couch. So you're going to find a sturdy piece of furniture or a staircase. You're going to roll over onto your side. And then you want to make sure you're turning your head in the direction that you're rolling, and then bringing your shoulders, hips, and legs in that same direction. So you're going to roll over to where you can get onto your hands and knees. You're going to push up through your upper body. Lift your head and just pause for a minute. Make sure you're not feeling dizzy. You're not going to black out, anything like that. Then you're going to crawl to that surface, whatever that surface is. If it's your couch, if it's your chair, if it's a staircase, you're somewhere in the community. You're going to put one hand up. You're going to try to get one leg up. So one knee is going to stay bent. Place your hands on the surface and slide one foot toward it so that it's flat on the floor. Place your hands on the surface and keep the other leg bent with knee on the floor. From the kneeling position, slowly rise and turn your body to sit in the chair or whatever your sturdy surface is. That if it's a staircase, if it's a couch, if it's, whatever's the sturdy for you. And then you're going to sit for a few minutes to try and make sure you're okay. Good job, Shannon. Okay. So, for therapy, how can therapy help when it comes to falls? So at Scotia, we do have physical, occupational, and speech therapy, and each of these play a vital but a different role in fall prevention. Of course, for physical therapy, that's what a lot of you have been through with us, and so you kind of know these things. But so we're going to work mainly, when you come to us for falls, we're going to work on lower extremity strengthening, typically always. We're going to work on balance. That's always a big one. Fall recovery, which is just what Shannon showed you guys. We're going to have you working on that. So we're going to have this mat on the floor. We're going to put you on it beside our mat and have you go through that whole routine of trying to get up off of it. Course, gait training, and that's, if your balance is unsteady with gait. And then we're going to try to help you get into either an independent exercise program if you're completely against going to the classes, or classes with Sarah that may assist you in maintaining what you have gained in balance and strength. So I'm going to turn it over to our OTs now and let them talk about what OT does for falls.
Howdy. I'm gonna let Diane speak first, okay?
Hey guys, how y'all doing? Occupational therapy. So do all of y'all understand what occupational therapy is? Okay. Because our occupation right now at this point in our life is to take care of ourselves, to get ourselves ready, to get ourselves dressed and get ourselves fed. All those things are our job. And then all those things are fall risk. Okay. So what occupational therapy is going to do is we're going to go through each one of those things and talk about the possible fall risk, okay? So I'm gonna start with getting up in the morning because that's the first thing we do. Something that I thought of as I was sitting in the chair is I've had patients actually fall out of the bed because their feet are tangled up in the covers and they don't realize it, okay? So try to remember when you first get up in the morning that your feet are coming off of the bed, not tangled up in the covers, okay? The second thing is you're going to sit on the side of the bed and you want to put on the proper footwear, okay? Everything needs to have a back. If you got bedroom shoes, that's fine as long as it has a back and fits correctly. It's not flopping on your foot because all those style of shoes create a fall risk, okay? Even for myself, I've had flip-flops on and tripped before, so I know it's a fact. I'm going to say in carpet, that's okay, but then once you get to the bathroom and you got the tile floor, that increases your chances. Now, the non-skid socks are okay to wear. So if not just socks, because if you wear regular socks and you go to that tile floor, wow, okay, right. It just, the facts will show it. You know, I don't know the science behind it, you know, really, but that's just a high risk for falls. People have fallen.
If you were to lose your balance, there's no, you don't have anything there. When you don't have anything,
No traction.
you don't have anything to do traction.
Thank you, Amanda.
So that's the thing. A lot of, and especially
If the floor's wet in the bathroom,
especially like after a shower. But also, a lot of times we see, and we've got one over there now. For example, we see people who will say, well, what happened? Tell me how you felt when you were home. I was just turning around. So you don't expect to go into the bathroom and fall, but if
Right.
you have one of those sudden falls where I was just turning around and lost my balance, and you don't have anything on your feet to give you that track.
help. So it's kind of that better safe than sorry kind of thing.
And sometimes even wearing like regular socks on the carpet, I've noticed depending on the type of carpet, like if it's the thick, fluffy light carpet, you can still slip and fall with just regular socks on. So they make like really cute grippy socks for like yoga now. But I've seen some really cute grip socks, even like at Walmart. So if you hospital socks, yeah.
No.
It does not have to be that. There are other alternatives to grip socks.
Right.
For people who want to wear grip socks.
So we're walking to the bathroom. That's usually the first thing that we all have to do in the morning. So make sure you got that correct footwear on. You know, if your feet are cold at night, then you can sleep in grippy socks. And you got it covered if you got to go to the bathroom in the middle of the night. You already got the grippy socks on, and it just increases your safety and decreases your fall risk. So then in the bathroom, we got the shower, okay? So just hold on to those grab bars as you're getting into the shower. Make sure, like I told a patient the other day, you know, anytime we add water and soap, that's going to increase the slickness, increase our chances of falls. So one thing I told her was when she finishes with her shower and she's rinsing off, to make sure that she has all the soap and all the shampoo and all that all out of the shower, okay? That's just going to help decrease because soap is so slippery, okay? So make sure you're doing that and just be very careful coming out of that shower. Try to make sure your feet are dry if possible. Try to get those appropriate footwear on as soon as possible. Oh, I thought you was raising your hand for something. So just try to be as safe as possible. The shower is the scariest place for me as working in OT, okay? Because you're not going to shower with your shoes on or your non-skid socks. So just be very conscientious and very safe when you're getting in and out of that shower. Okay, and then the next is getting dressed, okay? Try to sit on the toilet to do lower body dressing, all right? So not to be funny, but we're not flamingos. We're not made to stand on one foot, okay? And every time we do, it increases our fall risk. So make a habit, if you don't already, to sit on the toilet and lower body dress, okay? Yes. Yes, ma'am. That's perfect. Miss Kenny? Mhm. Right, right. I've been checking on that for her. Right, right.
Yeah.
We agree. We agree. Cheyenne and I had that conversation earlier in the week about, I think, the same patient. So, right,
Should just be standard in all the rooms.
right. It should be standard, exactly. So,
At some point, they'll let us have a little input on that whenever people are moving in and out, and we can kind of reiterate that, safety wise. It should.
Be careful.
Unfortunately, in independent, they don't
Huh.
necessarily put those in there, like up front.
I'm sorry.
They should.
I just figured it out on there.
Of course, my opinion.
Oh.
But
Shit.
yes, I think in every background they should. That's something they should be considering
That was on YouTube.
as people move in. And some people, I do understand it. There are people that are going to move in that are going to be like, no, I don't want that. That looks tacky. I don't want that in my bathroom. But right, right. That's my thought about it. And even if it does look tacky, if it's going to keep me on my 2 feet, it's okay. It'll have to be tacky. But that's right. That's right. That's
Right.
right. You have to ask for the handicap
Right.
rooms to ensure you get.
There's a fire alarm in our bathroom, but it's at the back of, I haven't figured out how you get up, use it, it's behind.
And the one that I use all the time
Behind
is
the
that
toilet.
one to get out of the shower.
Yes, ma'am. That's
That's
a perfect place.
That's what I was gonna say. That's a great place. So
They have that.
Okay, so back to the bathroom. I apologize if I interrupt anybody, but area rugs. Okay? No. I'm just going to say it plain. No. They're a great fall risk because our toes get caught on the edge, and there we go. We're falling before we know it. So, also, coming out of the bathroom, the next thing a lot of us do is go to the kitchen area and make our coffee. Okay? Again, we have a tendency to have cute little area rugs, and that is a fall risk, okay? So also, when you're making your coffee, you're reaching for things. If you have upper cabinets, please make sure you're not overreaching, okay? Overreaching puts us on our tippy toes, which will increase the loss of balance, increasing the fall risk. If it's something that you use every day, make sure it's down where you can reach it. It doesn't have to be on your counter, but maybe the lower shelf. So have someone help you rearrange that if you feel like that you're constantly in the bathroom or in the kitchen area or in the closet, that top shelf. If it's something that you're using during the winter, when fall gets here, start transitioning that stuff to a lower and so forth. Same thing in the kitchen. Stuff you use every day or really often, put it down where you can reach it easily, okay? Please do.
also, same with lower bending.
Thank you.
A lot of times people will bend and have a dizzy spell.
Right, right.
So if you have things that are really low, we feel like that's a safe place to put things. But if you start finding yourself having trouble bending or having dizziness or anything that changes, you might consider putting those things up higher.
Right.
More at an eye level so that you don't end up having that fall from bending over.
And that was a great segue into, if you're having problems bending, guess what? You need to come downstairs and we need to get a referral, okay? So we can figure out if it's strengthening or, what it might be. So, but yeah, those everyday tasks. And like I said, if you are having trouble, like Amanda said, please come give us a visit, and see what we can help you with. And I can't, is that all the ADLs basically? All right. Same thing in community. See, they get me up here and I get started. Same thing in the community. If you shop for yourself, don't overreach on those or reach low. If you feel yourself getting dizzy or anything like that, please let your doctor know, let us know, and ask for help from somebody nearby. Okay? All right, I'm going to let Cheyenne finish.
So one thing that we have, what's special to y'all here at Scotia, since therapy is right here and y'all are in Independent, we want to keep y'all in Independent. So we can come in and do home assessments. So all of the things that these ladies has been talking about, using the grab bars and just set up in your home, or the rugs, or say, hey, I like my rugs, I want to keep all my rugs. Well, I know we like rugs, but yes. So we can help you come up with alternatives, or help you find rugs that are safer, or just other options for that. And so you need help. Say you need help in, I'm having this issue. What do I need to do? Give us a call. I can come in, or physical therapy will come in, do a home evaluation, and tell you how to make your space safer. So some environmental modifications that you can do on your own is more lighting. So obviously, we've been talking about the vision. If you cannot see, or it's dim lighting, you're automatically increasing your risk of falling. So simple fixes is just using bright non-glare bulbs. Motion sensor lights are really good. So like if you want to put them in the hallway, or say you're one that don't like turning on all the lights at night, well, put in the motion sensor lights. So then that way when you get up in the middle of the night and you have to go to the bathroom, you're not walking in the dark and tripping over the rollator or a cat or whatever, or the rugs. So, or a flashlight at the bed. So then that way you have extra lighting. Clearing the way. So make sure there's no clutter. I keep a lot of stuff. I need to speak to myself about this, but decreasing the clutter on your flooring. So, we've already discussed the rugs, but also cords, extension cords. So like this cord's running across the floor here. This is a fall risk. You want to kindly keep them around the edges. Anything that don't need to be in the middle of the floor, move it. Making sure that there's clear pathways for where you're going and what you need to do in your home. We've talked about proper footwear, adaptive equipment. So like this thing that's over this toilet here, a lot of us have issues with standing from lower toilets. So you don't necessarily have to get a bedside commode. They have things you can buy at like Mabry's or Walmart or Amazon. This here is just a toilet frame, so it just gives you something to push up from. They also make them where the toilet's a little bit higher, so just whatever kind of equipment, we can give you recommendations on things that will make life easier. And also, just taking control of your health. So at Scotia, you have ample opportunities to keep yourself in shape. Sarah has all these classes. There's 2 different gyms here. There's a swimming pool here, an aerobics room. The place is huge. There's plenty of room to walk and exercise to keep yourself active and strong. And your therapy team, who is always here for you. And then also your vision, so regular eye checks, regular hearing checks, medications. I'm going to let Alexis talk more about medications, and that's it. Alrighty. Y'all have any questions for OT?
And if you do feel like you're having a problem standing up and need one of those, please don't just go out and buy it. Come to us because you might need some leg strengthening, you might need some arm strengthening, and then purchase that if it's another issue. Yes, ma'am.
I have grab bars
Uh-huh.
on my foot.
Okay, that's sufficient too.
Yeah.
Yes, ma'am.
And sometimes that's what we recommend too. It depends on how everybody's house, especially in independent scenes, everybody kind of has their own setup in their bathroom. So sometimes that's the best thing is to put grab bars in there and use those versus having a toilet frame. We've even seen some that a toilet frame wouldn't fit. You don't even have the room to put a whole toilet frame in. So there are lots of,
Some of the public restrooms here are very low.
yes, they are.
I need to do a request.
Yes, they are.
I have go to paper towel.
Okay, y'all, I'm gonna start a list and I'm gonna go to Alan and say, look.
They come on, the whole room comes off of those things.
Okay. You have to tell me afterwards, like where you're talking about, and I can.
I need to do a fall assessment
Of
of
Scotia.
Scotia. Yeah.
Alrighty. So as far as speech therapy, oftentimes whenever I see someone related to speech therapy, they're like, my speech is perfectly fine, right? Well, as a speech therapist, we actually cover everything from here up, okay? So that also includes your cognition. So as it relates to falls, one of the major things that we work on is your memory. Okay, there are different activities that we can do to make sure that we're targeting that portion of your brain and really zoning in on making sure that you're remembering to use your walker, your rollator, your cane, making sure that you're using it appropriately. If you do have a hip fracture, making sure that you're remembering what those precautions are. One of the best ways as you age to help you to recall items is visual aids around your home, right? So sometimes, like at my grandparents' house, we've put sticky notes all over the place. And sometimes you're like, oh, that's ugly. Well, there's other ways that we can make sure that it's visually appealing, but making sure that we place things in the appropriate places where you'll see them and actually help you to remember them. It's okay for you to say, for you to have a sign that says, hey, use your walker, but it's behind your door and your door is always closed or your door is always open. You'll never see that. So we'll work on things like that. We'll also cover problem solving and safety awareness. So we'll work through scenarios focused on safety. So for example, if you're walking down the hall at Scotia and there's a puddle, sometimes we don't realize, especially if we're always in a rush. That's just a simple example of things that we'll work through. Also things of the household. So as OT mentioned, what would you do if something was really high up, and we can work together to really process that, as well as medical situations. So what if you're taking a medication in the morning that makes you dizzy every day, but you're like, I really need this, right? So we can work through that, whether that's talking to your provider, whether that's making additional referrals, whatever that may be, we can work through that. A lot of you all, as Amanda mentioned earlier, or someone mentioned, have the bracelets or the necklaces that you use, but some of you don't. So even if you have family members that live at home and they want to stay at home, having a life alert is very, very important. We don't always get up and say, hey, let me grab my phone and make sure it's with me. That's an alternative. Just in case you do fall, you can make sure that you have something that'll get you help immediately. We've seen several cases, especially in skilled nursing, where someone will say, I fell and I laid there for 4 hours before somebody found me. Well, if you have a brain injury or something, then that's really not good. So having some type of device there that'll get you help ASAP is very important. The other thing, as far as problem solving and safety awareness, so as Diane was going through, your routine in the morning, one of the things that speech therapy can work on is actually sequencing those things, okay? Sometimes as we age, our brain, things that become natural or that are natural to us, they they become discombobulated and you forget, right? So you're like, okay, I'm standing here. What do I do next? So we can work on that to make sure that, again, you're maintaining your safety. Orientation is another major portion of the brain that increases your fall risk. We've seen people who will get up at 3, 4 o'clock in the morning. They think it's 8 o'clock on a Monday, and it's really, again, 3, 4 o'clock in the morning on a Saturday, and they're like, I'm going to work, right? So making sure that we have the appropriate visual aids, if that's a large print calendar, a large print time clock, or whatever it may be that suits you the best, to make sure that we're maintaining your orientation while you're here, okay? And then medication management, obviously, as Amanda mentioned earlier, fall risk are multifactorial, and we can work through what medications you're taking. Are you taking them appropriately? Are you remembering to take them? Okay, that's one of the major things that we see. If you miss 1 or 2 days, sometimes people are like, it's just 1 or 2 days, but those 1 or 2 days can be the days that you have a fall, right? So we want to work through and make sure that you're taking your medication appropriately, whether that means we can just establish a system. If you want to continue taking them out of your medication bottles, we can. If we need to get you an organizer, we can work through that as well. There's just different things that we can do, okay? Any questions for speech therapy?
Okay. So, when would I seek therapy help? This is always the big question. Being proactive, in my opinion, is the best time to seek therapy help. So, when you first notice that something has changed, so the first signs of any change in your typical task, such as difficulty standing from a chair, unsteady gait, difficulty stepping into or out of the shower. And that doesn't necessarily just mean difficulty in like it's getting hard to do that. That could be, well, I have a rug out here and it's kind of sliding. What do you suggest? It could be any of those environmental modification type things as well. Trouble reaching into cabinets, bending over to grab something, onset of pain, and that I put lower extremity pain because that's typically people think of lower extremities as being what keeps us balanced and strength, but that could be pain anywhere because, pain in our back can cause us to fall. Difficulty with stairs in the community. Again, not necessarily here at Scotia, but if you find yourself going to your son or daughter's house and they have 10 stairs with one rail to get in, and that's hard for you, we have stairs over here that we can work on. And then trouble with use of your assistive device. And that could be something that's new to you. It could be you've had an assistive device and you're just not sure that you're using it right. Maybe it's not the right height. Anything like that. So I always say it's better to be proactive. So if you have any doubt or any questions, it's better to ask us than to wait until it becomes a bigger problem and then you're having a fall.
And also with the pain, if for some reason you're having shoulder pain and you can't reach those grab bars like you were for whatever reason, that's also another reason to come see us. Yeah.
Right. Right. Okay. Any questions for us? So we definitely can make recommendations for that. We can get you on an exercise program that would help if there's certain things you're worried about, because obviously we certainly can't cure that. That's something that, especially us women deal with. But there are definitely programs that we can get you involved in that would help with that. Yeah. Yeah. When it becomes a big concern for you, or if you had fall, they do make, and we have seen this in skilled nursing probably more so, but they do make kind of it's almost like a pair of shorts, but it has the padding in places that are bony for folks that, if you tend to say this is your third fall and you always fall to the left side, so you have options where you can get a little more protection there before you get into a situation where you do have a broken hip or a broken arm kind of thing. There are so many things that we can adjust and adapt and help you compensate with. That's why I say it's just always better to come and find us and ask, even if you think it's insignificant. It doesn't matter. It might feel like that, but the smallest thing can cause you to fall, and you don't even realize it. I can't tell you the number of times people come to us after they come from the hospital with a broken hip or a broken wrist, and we say, how'd you fall? And they say, I really don't know. I didn't black out. I didn't lose my balance. They have no answer for how they fall. Sometimes they will. They'll say, I just turned around or I misstepped. But a lot of times they have no real idea of what happened. So that's why I say it's better to be proactive and prevent things like that from happening than wait until something already happens and then start seeking that help. It's like Cheyenne said, you guys do have a lot of opportunities out here that can help you with fall prevention. Anybody else? All right, Myra, you can cut us off of YouTube